Please provide an overview of PATH. PATH はどのような団体ですか？
So for over 40 years, PATH has been a leader in the global health community. And PATH was founded on the principle that new technologies that could impact health really should be accessible to everybody. You shouldn't be denied access to these technologies just simply based on where you were born. And so really that was the principle on which PATH was founded. The scope of our work is vast, but it's also very important that we're able to connect with the communities that we're serving and really understand the needs that they have as we engage in trying to improve the health in those communities. So we understand the context of their challenges by really embedding ourselves within the countries that we're serving. And over half of our team actually is based outside of the US, and 90% of our team members are from countries where we work.
Are there any challenges you are facing in your global health efforts? グローバルヘルスにおける取り組みで直面している課題があれば教えてください。
So one of the key challenges in our work with NTDs is the poor resilience of the systems in the areas that we work. We partner with the Ministries of Health to support the development of resilient health systems by generating evidence to inform policy, strengthening the capacity of healthcare workers, and to increase coverage of proven interventions against a range of NTDs, including onchocerciasis, visceral leishmaniasis, Zika, dengue, and many others. We also contribute to the strengthening of surveillance systems. We advance the use of vector control tools, improving diagnostics, and developing, evaluating, and scaling digital platforms to inform decision-making and to enable the monitoring of impact.
Please tell us about PATH collaboration with GHIT. GHIT と PATH はどのような取り組みを協業していますか？
Well, we've enjoyed collaborations between PATH and GHIT for over 10 years now, and several of those have been on malaria. And despite the progress in combating malaria in recent years, there's still a huge burden of disease, about 500,000 deaths per year and over 200 million cases, so still a huge unmet medical needs. So we're delighted to be partnering with GHIT on a new intervention. It's a prophylactic monoclonal antibody, and it really comes out of the vaccine work that we were very heavily involved in for many years. And early data for the vaccine suggests that it's associated with about a 13% reduction in all-cause mortality over 4 years in areas where it's been piloted. So certainly has potential to have impact. When the vaccine is given just before the rainy season, just before the children are at most risk, and that's where we see the best efficacy. But the challenge there is it requires 3 doses of the vaccine in the first year of life and then annual boosting. And so the monoclonal antibody that we're working with GHIT on, and we're partnered with EMA University and Eisai and GSK on this project as well. The idea is that this monoclonal antibody could provide similar or maybe even better levels of protection for young children through a single dose. That dose would probably need to be re-given every year, but wouldn't require the 3 doses in the first year of life, and could provide essentially immediate protection to those children once they receive the antibody, versus the vaccine, which takes longer. It's still at the preclinical phase, but we hope over the next couple of years it will advance to clinical testing.
Do you have any messages to global health partners in Japan and overseas? 日本や海外のグローバルヘルスのパートナーに向けてメッセージがあればお聞かせください。
I have 3 main thoughts I think I would like to share with Japanese partners and funders. I think first and foremost is just highlighting the importance of effective partnerships. Everything we do is really dependent on partnerships, and the partnerships between academia, industry, and PDPs like PATH, who bring this deep expertise in the global health product development environment, are really key. In the current project that I mentioned on the monoclonal antibody, We're very fortunate in that we are in the unique position that we have two pharmaceutical partners on one project, which is quite unusual, with a Japanese partner in Eisai, but also a European partner in GSK, working together with us in EMI University. And this has created a very strong partnership with great technical capabilities and resources to really move this project forward very effectively and to ensure that we've been able to meet all of our milestones. The second point that I would make is obviously the importance of funding, and we're really grateful to the support of GHIT for this project to continue to fund and support the project as we move it towards clinical testing. And funding needs to come from many places, not just from one funder like GHIT. So we have to partner together, not just to move the science forward, but also on the resources that are needed to fund these expensive projects. And then third and finally, I think just highlight the long-term commitment that's needed from both the partners but also the funders to move these products forward. It takes many, many years and requires a lot of perseverance and commitment. And we often see funders and partners evolve through the course of these long projects. And I think this is one of the reasons it's very important up front that we've got very clear business cases or value propositions, that this is a tool that the communities are really going to want. It's going to have public health input, it's going to be affordable, it's going to be accessible, it's going to be available. All of these things need to be de-risked to the point that we can bring in other partners along the way or other funders when it's time to move on from one funder to another to move this through the development and introduction phases to ultimately get to impact.
GHIT Fund. Fight neglected diseases through partnerships.